So something I haven't really heard before is the connection between dentistry and your airways.
I'll give you a little history.
Yeah.
Years ago when I went to dental school, we were taught that there's going to be a segment of the population that have high anxiety and stress and they grind their teeth. So what is it that you do? Make sure that they're restored properly, their gums are healthy, and then create for them a protective guard. They also taught us that the use of like anti-inflammatory medications, Advil, Motrin, cold packs, warm packs, and have them listen to Yanni.
Wow.
They actually taught have them listen to relaxation music. And that was like the information that we had. The evolution had to do with the discovery. 3D scanners, or CAT scans as they've been called, used to be solely in hospitals. So if you needed to get a three-dimensional image of a patient, you would send them to the hospital. Someone, I don't know who, said, you know what, we need to design these smaller scanners and x-rays that can take imaging, three-dimensional imaging, in dental offices. So now you have these scanners scattered all across the country, across the world. As a dental professional, when you scan someone's head and neck area, you have to have a relationship with a radiologist. Why? Because you may pick up things going on that are outside of your specialty. So this can, on many occasions, be a life-saving finding. The radiologist reviews the scan to make sure there's no pathology outside of these areas. But it also gave the opportunity for these three-dimensional images to be studied. So what they started to do, they started to compare the various three-dimensional images, and they realized that as the volume of the sinuses, the spaces above our top teeth and the back of our throat, as these areas got smaller, we started to see people having various symptoms. We started seeing changes occur in the mouth. Everything from breathing disorders, grinding their teeth, snoring at night. It's been related to restless leg syndrome. It's been found to contribute to people, adults and children, with ADD, ADHD. So the list goes on and on and on and on. So when a person is chronically suffering from breathing, it really stresses our immune system. So what's actually happening? When we breathe through our nose with a nice open airway, the oxygen is getting humidified, it's getting warmed, it's getting filtered, and a hormone called nitric oxide is being introduced. It's a natural dilator opening of the vessels in the airway. So the exchange of the air to the circulation has less resistance. People that have restricted airway are more prone to have high blood pressure. There's more energy needed to transfer the oxygen to the bloodstream. When the airway is open and we're breathing properly and our oxygen levels are staying high and we're sleeping like a baby, that really helps keep a healthy immune system. But what they're discovering is that for a variety of reasons, the human skull, lower third of the face, is getting smaller. They attribute it to a lot of things. The foods that we eat, environmental changes, women maybe not breastfeeding, or breastfeeding is long. And that's what some of these companies are discovering, that we can detect as early as 2 years old whether a child is on the right path to the growth of their jawbone. As a general dentist with this knowledge, I'm not the specialist in this, but it's a topic that every healthcare provider should be aware of. So years ago, I used to play a game with my hygienist where I would write down all the answers to the questions I was about to ask the patients. I would ask them, do you ever wake up with a dry mouth? Usually they say, yeah. Anyone ever hear you grinding or clenching your teeth? Oh yeah, absolutely. Do you have an easy gag reflex? Yeah, how do you know these things? See, our brain is designed to protect us.
Right.
And whoever our creator was says, I'm going to give you 2 places to breathe from. One's not working, don't let anything in the other one. So you see these people with a gag reflex.
Right.
So again, it's part of our protective mechanism. So I work with the various specialists whenever I early diagnose that and I get them to the right people. You know, it's again taking the approach that there is medical specialists that may help open up the airway so that you can breathe better. I've had family members that have gone through this. The energy that gets created during this nighttime grinding.
Yeah.
I came across a study that showed that the energy can be between 20 to 200 times greater than what we do when we sit here. That's why, especially during the pandemic, there was a huge uptick of people presenting to their dentist with broken, cracked teeth. What have we been doing? What were we doing? We were breathing through masks. Our oxygen levels through the day were decreased.
Right.
We're going to bed at night with decreased, and just the muscles of protection are just firing because the body's trying to create a vacuum to get it into our airway. The body's gonna say, I'm not gonna let you die on my watch. And the body's willing to to sacrifice part of itself for preservation. So it's an evolving topic. It actually has changed the way I treatment plan. It's changed the materials in dentistry. It helps us understand now why there's certain materials that fail. You know, you get a person that's a clincher and a grinder, you better make sure you use a strong product. I'm glad that I have people that can see this video to understand it.
Yeah.
And please, after this video, if you have questions, I'd be more than happy to answer them for you.